Hello everyone, my name is Sarah Al-Zubaidi. In this video, I will be discussing the ethical issues faced by a health professional in their typical workplace. Ethics is often used to refer to specific legal rules of conduct for government employees that emphasize conflicts of interest, as explained by Fox et al. According to the Business Dictionary, another definition of ethics is the basic concepts and fundamental principles of decent human conduct. It includes study of universal values, such as the essential quality of all men and women, human or natural rights, obedience to the law of land, concern for health and safety, and increasingly also for the natural environment. Nurses encounter countless of ethical dilemmas in their workplace. Dilemmas mostly occur when nurses are caring for patients with disabilities, which may potentially put them at risk of harming themselves. For instance, an aging patient might want to accomplish tasks alone, without any supervision. Even if the nurse wishes to endorse independence, the risk of those elderly patients getting injured is great. The dilemma at this point is trying to balance the conflicting issues and rationalize which aspect is more important, safety or independence. There are four main principles that are fundamental to a professional nursing practice. These include autonomy, beneficence, non-maleficence, and justice. Autonomy. Respecting the patient's autonomy is when the patient has a right to choose if he or she would like to go through with a particular medication or therapy. Patient autonomy, however, does allow professional healthcare providers to guide and educate the client or patient, but they are not held responsible for making medical decisions concerning the patient's health. Furthermore, nurses are also obliged to uphold the patient's rights, as well as to advocate for patients who lack the ability to advocate for themselves. Beneficence. Nurses are expected to display beneficence by supporting patients to reach their optimum level of well-being. This can be accomplished by offering care directly to patients or by enhancing healthcare guidelines, which impact a large portion of the population. Non-maleficence. Non-maleficence is when nurses are obliged to not perform any harmful acts on their patients. The nature of a nurse's profession requires them to perform certain tasks that may cause patients to feel pain. For instance, cases like such would be administering an injection. Another example is when a patient requires medicine to alleviate a certain symptom, but in order to reduce that symptom, the nurse might unintentionally cause pain or harm. Furthermore, non-maleficence needs to be balanced with the principal beneficence and providing healthcare at the same time. A nurse's intent of providing treatment to benefit the patient should outweigh the pain and discomfort. Hence, a nurse's aim should be to assist the patient, not harm them. Justice. Being just and fair is usually associated with the delivery of service. The present healthcare development plan was due to people knowing that the present healthcare system requires revision. Debate occurs on what is considered fair, reasonable, as well as economically achievable. As mentioned earlier, nurses are facing many ethical issues in their profession nowadays, particularly when they are providing health care for a patient currently at their end of life point. This case study occurred in Brisbane, portraying an ethical issue of a nurse who is taking care of a violent prostate cancer patient, Mr. Green, who has reached the end stage of his life, conveyed suicidal thoughts to that nurse, and asked her to keep the matter a secret. The ethical dilemma is whether the nurse should inform the other healthcare professionals about Mr. Green's suicidal thoughts without his consent, or respect the patient's secret and privacy and allow him to take his life with her knowledge. In order to solve this ethical dilemma in an adequate manner, the ethical theory, along with Australia's Nurses Code of Ethics Value Statement and the fundamental ethical principles, should all be extensively analysed prior to making the final decision. The nurse must consider the four fundamental principles before taking any serious action. Recent literature identified the association between ethical principles and ethical dilemmas. It is hence the rational incompatibility between two principles which causes ethical dilemmas, particularly in a moral situation where two distinct principles can be pertained, but utilizing one principle might breach the other. In Mr. Green's case, the principles beneficence and autonomy can potentially be applied correspondingly, yet none of them can be utilized without breaching the other. The critical rational incompatibility concerning beneficence and autonomy in this case study is a key reason that is causing the ethical dilemma on whether the nursing team should inform the other healthcare professionals about Mr. Green's suicidal thoughts without his permission. Additionally, non-maleficence should also be critically studied, as it infringes with the principal autonomy, but at the same time supports beneficence. Hence, when examining Mr. Green's situation, the three ethical principles in conflict of each other are beneficence, non-maleficence, and autonomy. In the health realm, one of the essential responsibilities of nurses is to provide the best health and well-being by taking positive actions. In this case, the nursing team must study and consider which action will be in the patient's most interest. Therefore, employing beneficence in Mr. Green's situation, the nurse needs to weigh the means and consider which decision will be best for Mr. Green. The principal beneficence necessitates the nursing team to do anything to offer the best health care for the patient and preserve their safety. In this case, Mr. Green's suicidal thoughts will hence involve the healthcare intervention, and this will consequently prevent the suicide from occurring. It will be a suitable decision to fit the principal beneficence. Besides beneficence, non-maleficence obligates health professionals of doing no harm. Regarding Mr. Green's situation, non-maleficence necessitates the nurse to take extreme measures in order to prevent the patient from causing harm on himself, rather than ignoring the patient's intent of inflicting harm on him. Thus, informing the other healthcare professionals about Mr. Green's suicidal thoughts prevents self-harm motives, and hence it fits with the principle non-maleficence. Moreover, the final principle to consider is autonomy. The principle autonomy demands respect for patients' right to take responsibility for their own medical decisions. In addition, autonomy requires nurses to respect the patient's privacy and confidentiality and make sure that the patient has approved any action taken. Employing autonomy in Mr. Green's current situation, that is, to respect the patient's secret and privacy, will cause greater consequences, hence leading the patient to go through with the suicide. Cancer patients are most likely to request assistance with death. One form of assisted dying is when healthcare professionals do not abstain the patient from taking their own life. In Mr. Green's circumstance, the action of keeping his suicidal attempt a secret is considered assisted dying. As emphasized by Sneesby, the ethical principle of autonomy is not upheld in law regarding euthanasia and assisted suicide, as people do not have the right to be assisted to die at any time they choose. Therefore, while Mr. Green's autonomy ought to be respected, it simply cannot surpass the common law, which prohibits healthcare professionals from supporting assisted dying. Consequently, after thoroughly examining the issue with the application of the ethical principles, a final decision was made. The ethical decision regarding the patient was for the nurse to disclose Mr. Green's suicidal attempt with her fellow healthcare professionals. In this case, the nurse made the decision to disclose Mr. Green's suicide attempt with the other healthcare providers. The nursing colleagues adhered to the self-harm and suicide protocol of the hospital firmly. They upheld the efficient communication with the patient, recognized the factors which may have caused the patient to encounter suicidal thoughts, stipulated the app nursing involvement to deal with potential risk factors, and cooperated with further healthcare specialists to prefect the case further. Mr. Green was then assigned to a palliative care service with absolutely no signs of suicidal thoughts, as well as other self-harm acts. Consequently, after Mr. Green was discharged with his relatives and pastor's company, he peacefully passed away 76 days after that. What the nurse did was only logical, and the way the other healthcare professionals and the nursing team dealt with the issue was utterly ethical, as all of the ethical factors concerning the issue were extensively examined. However, for future notice, the health professional body should take extra precautions when dealing with such patients. Mr. Green was an honest patient, but no one will know what and how other patients will act. Some patients may attempt suicide without even informing a healthcare professional prior to doing so. A recommendation would be providing these patients extra care and support, as well as extensive supervision, as they are in great need of it in such state. Thanks for listening.